Hi, good afternoon. My name is Shanalin Chaustegi, and I will be presenting my prospectus for the project Iris House Service Capacity on the Intersectionality of HIV and Gender-Based Violence. Iris House is an organization, nonprofit, that provides comprehensive services for women, families, and communities infected and affected by HIV/AIDS in New York City, and founded in 1992. I will be working from their Harlem office. The organization is a 501c3. The research questions I will be working with are: what is the impact of the current practices used by Iris House to address the intersectionality of HIV and gender-based violence? What is the current capacity of practitioners in Iris House to address the intersectionality of HIV and gender-based violence? In reading the literature, I also found that there is a potential third question which may come up during the study, and that is, are the tools developed by the gender-based violence field and provided by public funding culturally relevant to Iris House? The project will provide Iris House with an analysis for their capacity to deliver information, education, and services addressing the intersection of HIV and gender-based violence. The two programs in Iris House that will be analyzed are the Community Outreach and Community Education Program and their Reproductive Rights Initiative. The target of this analysis will focus on the delivery of education and direct services. I wish to conduct a qualitative study using the following data collection methods: a focus group with program participants who wish to volunteer responses regarding the services, workshops, and materials provided by Iris House that address the intersectionality, and interviews with staff who wish to volunteer responses about their capacity to address the intersectionality of HIV and gender-based violence. The literature I wish to review includes a policy memo by the White House addressing the intersection of HIV/AIDS, violence against women and girls, and gender-related health disparities. Also, the intersection of HIV and violence, direction for future research and interventions. There are a couple of articles that are not culturally relevant to New York City, but I believe they will shed light on vulnerable populations to this endemic, both pandemics at the same time. One is domestic violence, sexual ownership, and HIV risk in women in the American Deep South. Also, there is one that is a study findings from Southeast Regional Consumer and Providers Focus Group interviews. So that's among some of the literature that I will be reviewing on the Capstone project. And this is my presentation. I hope that it sheds some light on what my project's gonna be for this Capstone. Thank you so much.